Problem with healthcare, where to start? I mean, it starts with the insurance, right? Insurance is a scam. I've seen people go to chiropractors and worked with other docs who will treat a patient different based off of what insurance they have. Like, they know all the codes, and this insurance reimburses for this and this one reimburses better for that. And so whenever you go in, the doc will literally treat you different based off your insurance. Oh, you have good insurance? Like, we're gonna give you more. You have shitty insurance? Like, sorry. And it sucks because it's, all right, everyone should have the care that they require and the care that actually gets them back to what they want to. So, and I mean, I get it. I get it from the doc's perspective too. Like, they're running a business, they need to make money. If they don't make money, like, they can't keep the lights on and feed themselves. But at the same time, there's a moral conundrum there. So, like, I would never do that. If I had, like, I've told patients before, like, if we're forced to take insurance here and treat patients like that, like, I'd just move down to Florida and, like, clean boats or do something else, because it's just not worth it. And that's really what starts the whole problem with the healthcare. And then, you know, whenever you go in, you get treated differently based off your insurance. And then the studies that are done for either the drugs or the, you know, procedures or X, Y, and Z, they're all funded by the pharmaceutical companies that are then going to turn around and prescribe the drugs. And so they put out these different medications and drugs, and then, you know, there's a huge gap in, like, how many of them actually get pulled. I think it's like 30% or something like that get pulled back off the market because they're hurting people so bad to, like, that is the, you know, they're hurting people so bad that they literally have to, like, pull the drug off the market. It's like, well, how many drugs are hurting people a little bit but not bad enough? It's like a seatbelt warning in your car, like a recall. There's a certain percentage that they have to get to recall the car and fix it versus, like, it'll be okay. Some people will die, but, like, whatever. And so whenever you go to a healthcare provider, you're stuck in the limitations of your health insurance. The drugs that they're gonna prescribe you are possibly dangerous, and they're just masking symptoms, right? If you have pain and you get a painkiller, all that does is make the pain go away. It doesn't actually fix the problem. And then two, the insurance pays back less and less and less every year. So your healthcare provider, whether it's chiro, PT, MD, every year, in order for them to be able to make a living, they have to see a patient for less and less and less and less time. And I can tell somebody, like, as a chiro, if somebody comes in and they have back pain, I can go through and adjust them 2 minutes. Like, it's not that hard. Feel joints move, crack, crack, crack. Cool, do this stretch, see you next week. But it's at the patient's detriment. They're never gonna get the results. Same thing if I was a medical doctor and I come in and I have some sort of metabolic condition. It's much easier for them to just throw drugs at them and then, like, quickly on to the next patient versus I need to actually sit down and talk to this person and figure out, like, why they have the metabolic condition. Like, it's there for a reason. They're having symptoms for a reason. A symptom is just an indicator that something in the system isn't working right. So if you have lower back pain, it's not the lower back isn't the problem. Somewhere else is the problem. The lower back is just showing up. If you have a metabolic condition, like diabetes or something like that, the diabetes isn't the problem. It's showing us that something isn't working right. And the problem with healthcare is they don't take the time to actually figure out the real thing. And they're constrained. They're putting constraints by the pharmaceutical companies and the insurance companies that just, they're there to make their stockholders money. If they don't make them money, then they can go to jail. So the way that they make those stockholders money is they see patients for less time. They don't reimburse, and they are, if they keep people sick, they have to prescribe more drugs so they make more money. Like it's kind of crazy. Like people want to think it's not a thing. So that's the biggest thing, and it's really the whole system really needs to be uprooted because it's so inherently bad that it's so corrupt at so many levels, and it's really the whole thing just needs to be changed, from insurance to pharma to everything else in between.